First of all, let me introduce Veritas. Veritas is a foundation who is here as an NGO to promote healthcare in a traditional way in each and every house. So we are promoting Ayurveda, Siddha, Unani, and other traditional system in order to enhance again and make it available again, all the knowledge that people got along those thousands of years of activities on this planet. And to understand how to keep and maintain a good health. So we are here today with Dr. Pragya Pushpanjali, who is an amazing, what we call in the layperson language, she's an expert in children medicine. She will help us understand the seasonal cough, cold, and all the inflammation and recurring respiratory infections and inflammations, and how to handle that, and to understand when do we actually need to go and see an Ayurveda expert, when it's coming to the lungs, when it's deeper than that, and even how to solve a superficial lungs issue, like sometimes there's only wheezing, so what we can do. So bringing here someone like Dr. Pragya, who had the first degree she had in the BAMS, she started in Patna University, and now she's a teacher there, and she's an OPD practitioner there for the last 12 years. She's also expert in Swarna Prasana. That is a very interesting way of boosting immunity with kids. It's actually making their tissues mature and healthier in order to get their life easier as an adult. And it's a very unique technique that I highly recommend for you to understand how it's working. And those of you that would like to contact Dr. Pragya Pushpanjali, after that, can share with me their questions and their whatever doubts they have or anything, and we can share the contact and you can ask questions in private. But I suggest we will have questions along with nice sessions that we're going to hear now. So welcome, Dr. Pragya Pushpanjali.
Thanks, Afra. Thanks for giving me opportunity to share my most touched area, you can say, for every mother all over the world. They face this problem. That's why I chose this topic. Very common to every households. I think I will show some light of Ayurveda so that they can manage at home, and even they can adopt Ayurveda as well. We can promote Ayurveda all over the world. That is my motto also. That is also motto of Vedicas too. So we can spread it, Ayurveda, throughout the world together. I hope so. So can I start? Yeah. I welcome all the participants, all the mothers. Obviously, many of them will be a mother too. They will be knowing, must be. After some households are there also, no? They have joined.
Yes. Some households and so two doctors are here, and the rest
one thing I want to clear it. If they don't understand the meaning, some technical terms comes in Ayurveda, they can ask after the session. If I use some technical Ayurvedic term, I will clear it out after that. Okay, so we'll start right now. We'll start.
Please.
Is visible, no?
Yes, ma'am.
So as everybody knows, as a clinician, I face almost 40% of the 20 to 40% of the visit of child clinics, pediatric clinics, for the upper respiratory tract infection. That is of recurrent nature. That is it happens many times in a year. When it is called recurrent upper respiratory tract infection, when it is called respiratory tract infection, when it is called lower respiratory tract infection, we are not going to cover it lower respiratory tract infection here. We will only concentrate upon the upper respiratory tract infection. Why it is called upper respiratory tract infection and why it is called recurrent upper respiratory tract infection. We will discuss all the things. But first we go to the introduction. You can see on the slide. As I told, this is the cause of maximum number of physician visits worldwide. It's worldwide. Okay, it's very common morbidity in children. It comes with many type of morbidities after sometimes if it is not treated, if it is not well treated. It can't be taken as a very simple common cough and cold. If it is recurrent in nature, it should be taken into consideration. It affects all the ages and all the races and all the groups of worldwide. Okay, all the geographical area. It persists everywhere. It persists. You'll be surprised to know. Almost it's just a data from the net. It is approx $160 million is being spent in US only for the management of upper respiratory tract infections. It's a huge amount. You can say it's just a big money spending there. These money can be saved in many countries like India by adopting Ayurveda. So my aim is to spread it very widely so that cost can be cut down. We have in our OPDs, even in all the pediatric OPDs, as I told, 20 to 40% of almost all the OPD patients contribute the upper respiratory tract infection only. They comes in OPD for the upper respiratory tract infection. It is acute in nature. Parent has to visit the OPDs sometimes. Sometimes they don't. If they comes 3 to 8 times in a year, or if it is a child lesser than 5 years, it is said to be recurrent in nature. If it is more than 12, it is called highly recurrent. Recurrence is recurrent in nature, or the child is immunocompromised, you can say. Then there is a need of take it into a consideration so that we can manage it by the help of Ayurveda, because we will see in the next slide what actually this area is not given very much priority in the medical science, in allopathic side of science, because they think it's a common cold actually. But we generally in Ayurveda it is told as a precursor of many diseases, like even tuberculosis. It can end up into tuberculosis also. So when we see what WHO says, WHO has an expert committee comprehensive school health education promotion reported that the recurrent infections are a major cause of decreased school performance and school absenteeism. So it's a concern for the parents. They want their kids healthy. They want their kids to learn very effectively. They want their kids to be grow properly. They don't want to their kids to be hampered in their growth and development. So it's a area where we should concentrate upon. So what happens in allopathy medicine, the pediatrician used to give the antibiotics, and after that if they do not able to control that, they used to prescribe steroids. That steroids leads to the child leads to the child into immunocompromised state, so that the mere small infection hamper their growth and development. They can affect with any kind of infection. So we can prevent it by adopting Ayurveda. for this also we can promote Ayurveda. Why I chose this topic? As I told, I just want it to spread it widely. What kind of Ayurveda is giving in this condition? Which kind of treatment we can give? How we can help the children with RURTI, and how sustainable this solution is to prevent in recurrence. I want to share this classical treasure of the Ayurveda to the world. I wanted to share it. That is also my motto. And I want to provide a sure cure problem without much bother and without much expenses of money, so that they can. But where they can get it, they should get from the expert of that field, that Ayurvedic field, physician who are trained in Ayurveda. They should contact to them, they should ask to them, and then only they can start those medicine, they can adopt this medicine. As we know, despite of many antibiotics and all, steroids, it doesn't work at all in RURTI. So it's high time we should adopt for Ayurveda. Many households are there, many Vaidyas are there. They must be understanding what is upper respiratory tract infection. But some households or mothers are there. They must know what is upper respiratory tract infection. It is not a specific term. It is a non-specific term, you can say, where the infection of nose, paranasal sinuses, pharynx, and larynx all covers it. The infection of all these areas covers under upper respiratory tract infection, and this generally we say it as a common cold. When it is called as recurrent, as I told you before in my introduction, if it comes 8 to 12 episodes per year or more than that, falls under RURTI, that is recurrent respiratory tract infection. Why it occurs in children mostly? Why children are more vulnerable? Because they have specific anatomical and physiological peculiarities, and they have immature immune system. They are not immature. They are not mature enough to sustain the infection. They have anatomical immaturity. Their dhatus and their dhatus in balyavastha, they are immature enough, and their dosa's prevalence are kaphadik. We can say that in balyavastha, that is cough predominance is there. So that is the reason they are more vulnerable to the upper respiratory tract infection. In fact, you can say that respiratory tract infection, we are focusing on only upper respiratory tract infection. What is RURTI? As I told, when it comes 2 to 3 times in a 27 days, means in a 3-4 weeks, if it happens 3 to 4 times in a month, we can take it as RURTI, and it happens in children below 6 years of age. This RURTI is the definition of modern medical science. Actually, what in Ayurveda we used to say, we have a broad term pratisya, which is more which covers all the areas what is described in modern medicine. Upper respiratory tract infection is covered under that pratisya. So we can in Ayurveda we used to say it as pratisya, and treatment will be for the pratisya only. So from now this slide onwards, we will understand RURTI as a pratisya, and it covers all the upper respiratory tract infection, and it like common cold, influenza, sore throat, and acute bronchitis, pharyngitis, sinusitis, tonsillitis, laryngomyositis, and epiglottitis, even otitis media. All the symptoms comes under umbrella of pratisya we used to treat in Ayurveda, and in modern medical science it is upper respiratory tract infection comes under all these diseases will be covered under the pratisya. What are the causes? The causes are we have in Ayurveda. There are two type of causes. One is Nija, another is Agantus. Nija cause these that is idiopathic in nature, where you don't know the causative factor, causative agents. So you can't find it out. That is called Nija, and idiopathic you can say. And the reason is faulty ahar and Bihar is the reason for the Vyadhi, and another is Agantus Vyadhi, where there is a definitive cause like viruses and bacteria. As we know, viruses and bacteria cause the common colds like adenovirus, rhinovirus, coronavirus, etc. What will be the symptoms? What you get when you have upper respiratory tract infection? You will get rhinitis, that is inflammation in your nasal septa, and cough, fever, dyspnea, that is breathlessness, difficulty in breathing, loss of appetite, appetite will be reduced, and throat pain, infection of pharynx, pharyngitis, and due to pharyngitis, throat pain will be there, and sneezing. After inflammation in the nasal septa, there will be flow of watery discharge, or sometimes thick or thin, sometimes vomiting, and regional limb adenopathy, mostly cervical, temporal, and post-auricular. These regional limb adenopathy you can see there in this. These are the diseases in which RURTI is present as a symptoms. These are the diseases most of the Vaidyas know. These are the symptoms where RURTI is the common as a symptoms, that is primary complex subform of first stage of tuberculosis, lung tuberculosis, or this is worm infestation. In worm infestation also RURTI present as the symptoms. Protein energy malnutrition, allergic bronchitis, and reactive airway disease, and congenital heart disease. If the child has congenital heart disease, they will have the recurrent upper respiratory tract infection. And bronchiectasis is the condition where the alveoli is dilated in lung. In that condition, there is also a presentation of RURTI. Now we come to the Ayurvedic point of view about the RURTI. What Ayurveda says about RURTI. In Ayurveda, RURTI is said to be a coast-janit vyadhi. It is arise from the digestive systems. It is in Amasa, that is the place of Jatragni, where that is if there is Mandagni, there will be there will be a respiratory tract infection. It is said in Ayurveda. And the main involvement of the dosa is cough and pitta. And when we observe the symptoms, we will see the dominance of this cough and pitta dosa visheshan. And dhatu, this dushti is rasa, since it is a first dhatu after the Jatragni Pak, it is the first dhatu. So dushti, so margas dushti will be there. And rakta, sometimes rakta, mostly in tuberculosis, if it develops into tuberculosis after later on, then rakta dhatu will be, drushti will be there. What is the main aims and objectives of RURTI management? It means how what is our Ayurvedic aim, what we want. We can give it to when we can give child to antibiotic, we can give them any inhalation therapy, we can give them any gargling, we can give them any steam kind of thing. They can get relief sometimes. But why do we aim it about we should give some medicine, proper medication, proper care? Why it is needed? Since uh, the aim of this management is to reduce the intensity of further infection. We don't want every time that child should infect with the same condition. They suffer for the school, they suffer for their growth, they lack their appetite, and their growth and development at this age, from 2 to 6 years, the most growing age of the child, where and dhatus are grows there. So we can't take a chance to suffer them. So the aim of and objective of this management will be these headings. Under these headings, first we have to reduce the intensity of further infection, and second we want to reduce the recurrence, and third will be it should not be land up into the another disease like pneumonia, to prevent it. So that complication, prevention of complication, and lastly we want to cure that disease, we want to cure it perfectly, we want to cure it. So that's the aim and objective of this management. What Ayurveda says, what Ayurveda, how we proceed in Ayurvedic management, what are the principles? We can clinically we have observed that in RURTI, minimum of 6 months of medication and lifestyle modification is a must. And the patient needs to be educated about this, that medication, that lifestyle modification, then only they can get the actual result of the prescribed medicine, and they can get cure out of it, they can get rid out of it. And one more practice is also there, is very effective, found effective in this management, that is murdha tel application over the head. What kind of murdha tel should be taken in this case? It should be kaf vathar or either Itra samak. Any of tela can be taken. For example, that is take rajadi tel is good for the murdha tel in RURTI. It is found effective, and one tel can be made in that sarsak tel, that is yasti, and Krishna Jirak and Kusta Sadit tel. We can make it at home also. You just take the oil of coconut oil, and you put some yasti, some Krishna Jirak and Kusta, that is Sauceria lapa. You and boil it them, and then boil it for some times, and just stir it, and आप उसको छान के यूज कर सकते हो. That is आई एम नॉट गेटिंग द एग्जैक्ट वर्ड फॉर दिस. You can sieve it, and you can use it. And what will be the plan, management plan? First priority will be given to the Pathyapat. Without Pathyapat, any medicine will not effective. It will be not effective as much as we want. So Pathyapat is the foremost in any diseases. This is the principle of Ayurveda. We have to focus on Pathyapat, that is diet, wholesome diets, and the lifestyle modification. And the disease, and the another second one is medicine recommended for that certain condition, that is called Hetu Viprit and Vyadhi Viprit treatment for the 3 months, and another 3 months we have to give the Rasayana treatment for their immunity enhancement, that is Balvardhana. So in Pathyapat, Ahar is the given prime importance. As we all know, Ahar is called as Mahabhesaj, means it is better than any medicine. It is foremost in any medicine. So, as we know, respiratory disease, it is all respiratory diseases are said to be originated from the Amase, that is coast. So, Pathyapat, if we concentrate upon the Ahar and means diet wholesome to that condition, the result will be more beneficial, and priority should be given, like 70% priority should be given to this area, Pathyapat area, and avoidance of all the foods which produce an allergy should be avoided here. What kind of ahara should be taken in as per Pathya? We should avoid curd, toffee, soft drink, cold drinks, chocolates, fried items, flavored items, even grapes. Grapes also causes allergy, so we can avoid it because they use pesticides over the grapes, while the farmers used to use pesticides for grapes, so we can avoid it also. It also causes allergy in small children. Milk and milk products, it should be also avoided. What should be practiced? Brinjal and sigru should be practiced. And use of turmeric and sarsapa, that is mustard seed, lasuna, that is garlic, and kusman, that is asgard, and black pepper. It should be practiced in daily dishes in ahara. What bihar we should practice? We should practice hot water drinking and sarsap tel abhyang over the chest, regular abhyang, and rasnadi churn. It's a kind of medicine. It's a medicine generally used in RURTI, in cough and cold. It is used as a talam after panchakarma procedures. This rasnadi churn should be applied over the head to prevent the recurrence. What should be avoided in this condition? The drink cold water, bathing and drinking both, and daily head wash. Some child or some parents are very much conscious of hygiene. They used to wash shampoo their kids daily. It should not be done in this condition. They should not be sit or lie under directly under the fan. It should be avoided. Now we come to the management side. What should be given at what condition? How would we proceed for the proper management? So clinically we see the patient come with mostly with this three kind of complaints. In one kind, the fever is the dominant symptom. When fever is the dominant symptom, child will have feverish or feverish feeling or fever as an initial complaint, other than rhinitis, cough, loss of appetite, etc. And if they have already taken medicine from any allopathy side or anywhere from the any side of discipline they have taken, but they don't get that relief from that feverishness or fever. So in this condition we can advise them this Indu Kant Kasai, Kankasav and Amrita is all three are in equal quantity, and 30 ml thrice a day before food, and this dose should be lower in below child 4 years child. It is for above 4 years child. This dose is. And another powder form is Guruchi, Pipali, Sati, Musta, Rajanyadi Chur. It's again a combination drug from Ashtang Hriday for balrog chikitsa. This Rajanyadi Churn is very good Deepan Pachan, and that Sudarshan Churn, it is indicated in Jwara Rogadikar. So this all should be mixed well, and should be given in amount of 2 to 3 gram with honey before food. So if the child comes to you complain with the fever as a dominant, in this condition you should prescribe these two medicine, and you will get very good result. If the child comes with pratisya, means running nose or inflammation in nose and breathlessness and cough as a dominant symptoms, again we have to think here that what is the dominant dosa is here. It should be keep in mind. It can be of two types. One can be of pitta dominant, another can be of kapha dominant. Pitta dominant dosa, the children will have complaint of stomatitis, that is a mouth ulcer, and recurrent skin lesion, rashes and all over the skin, and nasal excoriation, means ulcer near the nasal, because there will be running nose all the time, and there will be excoriation. If there is that excretion is nature in pitta dominant, that will there will be usnata there, and that will create that inflammation, and that may further cause ulcer there around the nose. If that is kapha dominant, the child will complain about the rhinitis condition will be increased. There will be thick nasal discharge. There will be loss of appetite. Child will not accept any kind of food, and he can complain about the sometimes abdominal pain, and one thing we can observe over the face, that is the white patches over the face we can observe. In that condition we should think upon this is the kapha dominant, and in both the condition the drug will be the different. In pitta dominant we will choose this panchamrit kasaya, amritarist and kankasav. Again it can be given in amount of 15 to 30 ml thrice a day before food. Any kapha dominant, the small katutraya kasaya, and kankasav will be in double dose, because there is a cough dominance, there will be problem, there will breathlessness can be there, more breathlessness can be there. So concussive dose will be doubled in amount, and it also can be given in 15 to 30 ml thrice a day before food. Third condition is where the child will come with a achaya condition, means decrease in normal dhatu condition, means he is not getting any improvement in his body weight or height. Means child will fail to gain their height and weight. In that condition, you must be cautious, because it can be a kind of chaya condition. So here we should opt for the Ela Kanadi Kasai and Amrita Rist and Kankasa in equal quantity, all three. It can be given 50 to 30 ml thrice a day before food. These are the medicine. These are the medicine, some 5-6 medicines in all the three conditions. You can use it and you can apply it. It will give very good result. It is clinically tested for a very long, and it is very effective. So we can follow it, and we can prescribe it. We can take it by advice of any Ayurvedic physician. And these 3-4 medicines are said to be Vyadhi Viprit or Hetu Viprit, means it is recommended for this condition, respiratory illnesses. it can be given. So it is recommended. Again, one is Pathyapat, another is the treatment given for the respiratory illness. It is said it is given to it is given to 3 months, and another 3 months we have to opt that Rasayana therapy. It's Rasayana Chikitsa. It should be given 3 to 6 months, I can say. If it is given to 6 months and more, it will give more good result. That comes in Rasayana therapy. These very common medicines like Chyawanprash, Indukant, Kusmand, Agast Rasayan, these can be select. Chyawanprash is can be given in all the condition as I told it clinically. If it is fever dominant, if it is Swaskas Pratisai dominant, if it is Chai dominant, in all the condition you can opt Chyawanprash. And Indukant, if it is fever dominant, it will be very good. Indukant Kasaya or Ghrita form is also available. It can be given. And Kusmanda Rasayan, that is in Chai dominant. Kusmanda has a can be given in Chai dominant. And Agast Rasayan, this is if there is a Pratisai Kas Swas dominant disease, you can choose it. So it's all about the very short and brief clinical observation of my side is shared. So it's all about.
Yeah, it was wonderful, Dr. Pragya, Vedya Pragya for me. Can we ask questions now? Is it okay now to ask questions, ma'am?
Yeah.
Okay, anyone in the audience here have questions? If yes, then please raise your hand and we can unmute you. Now everyone can see everyone. No, there are questions. I have a few questions.
Yeah.
One was, first of all, there was someone from the YouTube that said very nice information. So yes, very nice information. Thank you. Also, what if there is diarrhea?
What is?
Diarrhea.
Sorry?
Diarrhea.
Diarrhea.
Right.
Not getting, actually.
What if the child have diarrhea on top of this?
Then we have to give some Dipan Pachan medicine. It is given, that is Rajanyadi Churn is there. That will manage the diarrhea also. That's why that in first slide I can show you.
No, it's okay. You don't need the slides. It's an answer to a question. It's okay.
When I described it with fever dominant condition, there is a churn. That churn can be given. In that churn, there is Rajanyadi churn can be given in all diarrhea condition. That will be very good. That will do the Dipan Pachan. And actually, as I told, it is a coast janit vyadhi. So we have to focus on coast only. So if there is a diarrhea, that is temporary and it will get cured by the medicine that is added on. Pachan will be there, and
okay.
After that it will resolve automatically. It will resolve by giving Rajanyadi Churna. Yeah.
Okay.
And another Dipan Pachan medicine they can use if they are Vaidya. If they are common people. For the common people, Rajanyadi Churn can be used anywhere in any condition, in any child disease.
So you said that in one of the reasons it might be due to parasites. How can we find out about that? Worm infestation.
Worm infestation. First, then again we will have to focus on that worm. That is the root cause. There is there is three principle written in Ayurveda for the worm infestation. One is Nidan Parivarjan, another is Hetu Vyadhi Chikitsa Prakriti Vighar, and another last is Upkarsan. Means we have to stop the things which promote worms. It should be stopped, like chocolates, like that refined flours, and that sweet things should be avoided. It should be stopped giving to the child. They are the precursor of worms actually. they get very late absorption in digestive system. They stay longer in the intestine, so that they are favorable for the originating that worms. It should be avoided. Any kind of that your refined flour should be avoided. What you said, that is, we used to say in India, that is maida. It's maida. Yeah, that is a refined flour. That should be avoided everywhere, like noodles, Maggies, and all the things should be avoided. Chocolate should be avoided. Another is some medicine is given for that condition. Krimi kuthar, krimignavati, krimisodhanivati, etc. can be given. And third is upcursion, means we have to eradicate, we have to remove that worm from the GIT. So we can give Abhipattikar Churna, Krimisodhani, Krimisodhanivati. These are the medicine extract the worm out the GIT.
So when it comes to worm infestation,
yeah, we have to focus on worm only.
So it's better to come to a practitioner.
Yeah, first we have to concentrate upon worm. If the worm condition is resolved, the RURT condition may resolve automatically.
Okay.
So yeah, we have to focus upon the root cause. That is the hetu.
Right.
Reason for the RURTI.
So if someone doesn't know the
worm is also the reason for the RURTI.
Right. So another question. You said
I think I speak too fast.
Anyone has? No, it's okay. We have questions about there is worm infestation, and there was. You said allergy. What is the difference between allergy and bacteria? How do we know what is the cause?
Allergy is a kind of there is not known cause, not a known cause. You have there is a your immune is react to that particular things, like your innate reaction to that particular thing, that is allergy, and bacteria is the causative agent. It's an agent. It will cause. It has if we get the culture or anything, sputum culture, or if we get blood culture, we will get that bacteria there. So we can identify it as bacteria there. And in allergy, we cannot detect any species there, like virus or like bacteria. Anything we can't get there, and we can only understand by the manifestation in the body, reaction in the body. We can understand it is allergy. Like sometimes we can get increased IgE level. We can get in that condition, in atopic condition, that is called atopic allergy. In that condition, we can get increased IgE level.
Last question. If the mucus from the nose it's not transparent, it's like yellow or green, what should we do?
We should do all the things we prescribed in, we discussed about, but we can do that Anu tel or Sadbindu tel application over on both the nostril. We can apply locally. If you don't have that Anu tel and Sadbindu tel, we can use you can use that ghrita, that is ghee, cow ghee. You can use mustard seed oil. That also you can use there. That will also beneficial. That will lubricate the area, and the another further irritation will be managed, and mucus discharge will be going down there. And you have to add some medicine also, internal medicine.
Okay, thank you, ma'am. I have one question from my side. Like me, when are we going to do Nasya?
Nasya, you can use Nasya is a Pratimars, 2 drops daily, every day, routinely you can do. But if you go for any certain disease, it is a condition where you can use Mars Nasya, that is given for the certain condition. You should take it under the Salakya people, like IENT people. Under them you can take
But we
it.
can come to you. But we can come to you too, no?
Yeah, of course, of course.
Okay.
Anytime you can do.
Thank you, Vedya Pragya.
Thank
And
you.
I hope to see you here soon again with more
Okay.
topics about kids.
Okay. Thank you, Avda. Thanks for giving me
Thank
opportunity.
you, very
I
good
hope
community.
everybody has their doubt clear. I tried it. Next time I will come with some better
Well,
and
it's
more.
okay. We will talk more and people can reach you. It's okay.
Okay.
Wonderful.
Okay.
Thank you, Vedicus community.